Hi, folks. Thanks for being here. We're just going to wait another minute for folks to sign on since people are still coming in. Hello, everybody. Regardless of where you are, hello and welcome. My name is Teddy Sferanos of the Harvard Kennedy School. One of my roles at the Kennedy School is Faculty Director of Training at Evidence for Policy Design, which is a research group based in the Center for International Development. As I hope you all know, we're using the Attendify platform, so please respond to the polls on the Attendify platform as well as use the chat throughout this session. I want to briefly introduce our panel that I'll be moderating. So I'm joined by my colleagues Mehnaz Rabbani of the BRAC Institute of Governance and Development in Bangladesh. We have Anshu Singh and Shreya Singh of LEAD at Krea University in India, Charlotte Tuminelli, who is based at EPoD in the US with me, and Amelia Knudsen and Laura Metzger, who are helping coordinate this and helping with the organization on the back end. We've all collaborated together, everyone on this panel, on the delivery of the BCure programs, which we'll be talking about. And more broadly, we've worked together on capacity building to build trust in and skills for using data to inform governance. So today we're going to be sharing some of what we've learned. The way we're going to organize today's panel is each of our panelists is going to take some time to present some information about the program, how we think about the content and the delivery for these trainings, and how they start to translate to application outside of sort of the training room. So please do put questions in the chat as we go. We've reserved time for each panelist to answer a couple of questions at the end of their section. We really do want to get as much feedback as we can from you, so please do use the Attendify chat as often as you can. Again, we're using Attendify instead of Zoom for the chat. So we're going to present an overview of what we call BCure, which is Building Capacity to Use Research Evidence, a training program for civil servants. We'll talk briefly about how this program came about and how we identified needs. We decided that capacity building for civil servants was something that we cared a lot about, but trying to understand how we should actually target our trainings mattered quite a bit. So we did a needs assessment among South Asian civil servants, and the two big areas that we found the need to increase were skills in using data and evidence in policymaking, and also motivation for doing so, to encourage a culture of evidence among the policy actors that we were targeting. As you saw in the polls, if you haven't seen them already, many of you have also identified other big issues that you've encountered, so hopefully we can touch on all of them. Another key learning that we had is, in addition to the individual level constraints we had examples of, we had big organizational barriers to data and evidence use, as most of you identified in the poll. So these persist as reported barriers even today, and the BCure program aims to chip away at the individual level constraints, but later in the presentation, we're going to try to talk about some of the more organizational work that we're doing to try to shift the barriers in organizations. So to provide you with a quick snapshot of the program and how it's played out, we've been able to train over 6,400 South Asian policymakers in the BCure curriculum since we started the program. A big piece of reaching this level of scale has been a training of trainers approach, in which we first train local faculty in the BCure content and teaching methodology, and then they go on to instruct civil servants. So BCure content has always been institutionalized with this model as part of the curricula at the National Civil Service Training Academies in both India and Pakistan. And as we'll be discussing throughout the presentation, we do have some evidence to support that the program is moving the needle on individual motivations and abilities to use data and evidence in policy decisions, as evidenced by these post-training surveys and learning assessments. So with that, I'm going to turn it over to Charlotte to share more about our pedagogical approach, which we refer to as blended learning. Charlotte?
Thanks so much, Teddy. It's great to be here, and I'm excited to talk to you all today. I'll now dive into both the content and the pedagogical approach underlying our program. So, working with civil servants brings with it a host of opportunities and challenges, and all of which are really important to consider when we design and deliver our in classroom workshops. So I'll speak now to these two areas of consideration, the content, so skills and frameworks to empower and enable policymakers to use data in decision making, and the approach, how we teach this. And I'll also touch on how we decided on these two things. So when we conducted that needs assessment that Teddy referred to at the outset of the Be Cure project, we looked at data from surveys, skills assessments, and focus groups. These are the 7 topics that we identified as being really critical to building individual level capacity to use data. Each of these modules is a digital module. It's self-paced, and it's designed to take about 90 minutes to complete. And the modules focus not just on technical tools, but also on motivating the use of evidence and engendering trust in data. So for example, questions in the using data systems module at the bottom right of the screen are designed to help learners think about a data system that they already work with, contribute to, maybe helping to build, and then how it could be improved and why they should care about improving it. My colleagues Anshu and Shreya will actually delve into this particular topic in greater detail later in the presentation. With these topics, the Be Cure units aim to establish a common language around data and evidence use and give policymakers some baseline skills to use data and evidence to make decisions. They can be delivered standalone as a suite of all 7 modules in a full week-long training, or as pairs of different modules that go together. So I want to take a moment to note that in thinking about our audience, we often decide to have training participants complete this digital content in a computer lab setting as a dedicated part of the agenda. If you're to log on and look at it, it may look very much like a MOOC that you've seen before, where you can move through things at your own pace. And that's certainly one way in which we teach these, but it's not always realistic to expect these busy government officials to have time to complete something that's perceived as quote unquote homework. And then I'll explain on the next slide that having the digital content completed by learners ahead of time is really, really integral, both to learning the concepts that are put into the content, but also to our instructors' ability to customize their in-class teaching. Hence why we are sometimes a little more prescriptive around dedicating that computer lab time for learners. So after learners complete those self-paced digital modules for a given topic, they will take a corresponding live class session for that same topic, which is going to use learner data, which are the answers that they input into the digital modules themselves, to gauge learners' mastery of key concepts and help to customize the delivery. So for example, if I'm teaching the session on impact evaluations, a really key concept that I want my learners to understand is that of the counterfactual. So the idea that if we're evaluating a given program, it is both really difficult and really, really important to try to understand what would have happened in that program's absence. So if I, as the instructor, am at this second stage here where I'm looking at my dashboard and I see that answers that learners put into the digital unit indicate that they're really struggling with this core foundational concept, then I know to spend a decent amount of time in the session making sure that we cover it in detail and establish comprehension. And then on the other hand, if 99% of my classroom seems to already understand this concept, then we can spend time on more advanced topics and take the session even deeper. So blended learning thus optimizes the live and in-person time, although these days it's definitely more virtual, but by allowing instructors to focus on the most high impact, high importance concepts for their particular set of learners. In terms of thinking about contextualization, the other side too is that our live sessions feature context customized in-class exercises. So based around a certain region, certain topic, that allow participants to apply concepts to a case style scenario. So putting them into the shoes of a decision maker, trying to use data to solve a policy problem and taking the learnings into a more applied direction. So again, that needs assessment that we did, I'll note that that was with mid-level civil servants as a starting point, but we quickly learned of similar needs across different levels of the civil service in the countries we were working in. So when we think about why blended learning is the right approach, it allows for the customization of content that I talked about previously, targeting to different levels of comprehension, but also seniority within the civil service, and critically pulls in learners' expertise. So that's really, really important to acknowledge and leverage for a whole host of reasons. You've got civil servants who have been working at their job for decades, and bringing in their expertise allows for a better learning experience, opportunities for peer learning, better engagement, and again, really honing in on that applicability to real world contexts. So we've seen success with this model, as evidenced by the assessments that Teddy pointed to earlier. But as you saw in the polls, we put forth some on the Attendify page, and there still remain a lot of barriers to actually using data and evidence in government and practice and into teaching this type of content. So I'll close this section by reiterating that we have found blended learning to be a really effective model for addressing some of the individual level skills. But a lot of you called out organizational barriers and sort of more complex translating of the point at which you're learning an individual skill and then being able to apply it when it comes to that classroom to workplace knowledge transfer. So my colleagues will go on to talk about different capacity building efforts that are sort of part of our holistic model and help us work on these organizational issues. So in a few moments, I'll turn it over to Manaz, who will speak a little bit more to another specific challenge that we see in our work and try to address with the blended method, which is working with heterogeneous groups of learners, namely policymakers and researchers, which are two distinct but equally important audiences for us to be thinking about when trying to cultivate a culture of trust in and use of data. So with that, I'm happy to answer any questions if Teddy wants to jump in with anything before we turn it over to Minaz.
Absolutely. Thanks, Charlotte. And please, again, to the participants, please use the Attendify chat to post any questions you have. I'm happy to share them with the panelists. Charlotte, I'm curious. So blended learning is something that I suspect a lot of us have now been exposed to simply because so many of us or our children or our families have been engaged in learning online in the past several months. So folks are used to having some kind of preparatory material and then having class be some kind of more engaging context. But blended learning, I think, is relatively novel in the training space. So one question I have for you is sort of how context specific does the blended learning content have to be in order to be useful for people, right? So we're using the same sets of videos and interactive modules around the world. How context specific did that content have to be to still be useful to the policymakers?
Absolutely, Teddy. Great question. Thank you. And yeah, it's interesting. I've been at this work for about 4 years now. And this past year, give or take, has by far been the one in which the most attention has been on digital learning. So I will note before I get into the question about context too, that the way we think of blended learning is not just that online and in-person delivery, but that adaptive stage. So where you can take the information. And I think a lot of instructors, both training for capacity building, and then even you have K through 12 and university instructors who are starting to experiment with that, given that all sessions now, basically, you have so much less information than you normally would in online groups, especially if you're starting to work with, a new set of learners that you've never even met before. So that was always sort of the edge that we felt our blended learning brought to the table. And it's really exciting to see that that's being used more. But to the question about,
I see.
Yeah.
Go ahead.
I'll answer that as well. So it's funny, one of the concepts that we actually teach in our digital units is that of external validity. So when learners are looking at a study, and they're trying to apply it to a policy problem that they're facing that's similar, to look at the relevance that it would have for them. And I think, you know, we encourage learners to engage critically with that, but we also try to impress upon people that often a study will have validity in your context, even if it's not immediately obvious, especially when you're honing in on mechanisms, or I guess I'll draw a parallel to learning itself, to learning concepts. So when you're looking at a case study and it's just trying to teach you the concept of reading a basic bar chart, the context shouldn't matter too much. And if, for example, I'm a learner in Pakistan and I'm using a case based in India, in theory, you know, that concept is going to be the same whether the case is based in my domain expertise area or my country. That said, practically speaking, it's really important for our learners, and I personally get it. I think if you're sitting down to engage with a case that's based in your context, you're more excited about it. So that goes, I think, like, that's not worth nothing, right? Like, encouraging engagement by getting people excited about the materials that they're using is a big piece of learning. And then I guess the other thing to mention is that it can matter more when thinking about external validity in specific areas. So for example, we're thinking about doing a BCure training with a group of folks who are coming from different countries and all working on issues of violence against women. And in that particular example, the policies that are already in place and the issues faced among these different countries are super varied. And so it'll be an interesting challenge for us to create content that communicates the concepts we're trying to get across, but also helps learners abstract away a little bit from the fact that their policy context might be a little different from the person they're sitting next to in the Zoom room.
Got it. Thank you so much. And thanks for that clarity on adapting. If other folks participating have examples of needing to adapt training materials or challenges with moving training materials between contexts, I'd love to hear that in the chat as well. One more question, Charlotte, and then we'll move on to Minaz. Have you actually experienced, or can you think of maybe examples where this kind of work has actually led to better decision-making in some way?
I mean, I'll say, of course, right? Like I said, we've been doing this work. I've been doing it for 4 years, and there are so many people out there who have dedicated their entire lives to this. So we do have wins, and we're excited about those. Within the education literature more broadly and the learning space, and certainly capacity building for policymakers, this measurement of behavior change is really, really hard. So I'll stay up front that, well, we're doing some interesting research in this area that maybe we can talk about a little bit later. But in terms of what we have to rely on right now, it's definitely a lot more examples, and particularly examples that we develop from working hand in hand with collaborators. So I have some really exciting examples that I could happily point people to on our website that get into, you know, people saying, I took a training on cost benefit analysis, and then I went back to my desk and I did a CBA and I gave it to my supervisor, and they were bought in, and they allowed us to use that to dictate whether we do the program or not. Now, there's so many factors that need to be in place to enable that to happen. I mean, think of that supervisor and you know, their predisposition to using data and evidence, the incentives in place for promotion. You know, people are often actually disincentivized to, you know, rattle things up in the workplace and suggest change like this. So I'll acknowledge that a lot of the success stories we see, we call these being sort of brought forth by champions of evidence. So a big piece of the work that we do in the like deeper dive into capacity building outside of the classroom that Anshu and Shreya will talk about, is designed to cultivate those champions and then start to work with the organizations around them to build more of a culture that enables this type of classroom to workplace success story.
Wonderful. Thanks so much for sharing that, Charlotte. So if you don't mind, we're going to now move on to Minaz from the BRAC Institute, who can talk a bit more on targeting content for heterogeneous learners. Minaz, it's great to have you. Take it away.
Thank you, Teddy. It's a pleasure to be in this panel. So before I start, I'll just, a disclaimer, I was asked to talk about the challenges of targeting content. So I'm going to focus on challenges at the risk of sounding like that's all we have. It's actually a very good idea to have different kinds of learners, policymakers and researchers in the same room, in the same training, and it's something that we've been doing for a long time and it works. But of course there are challenges, so I'm going to focus on that. So what we did in our training is we had policymakers, researchers, academics, and also practitioners. Generally, we call NGO employees as practitioners as well. So why do we do this? Why do we bring policymakers and researchers and practitioners together? Well, because policymakers in reality do not work in isolation. Decision-making is an iterative process with communication, however fragmented that might be or ineffective that might be, there is interaction between researchers, policymakers, and practitioners at different levels. So it is necessary because the decision-making process involves all of them, for all of them to be in the same room when they're learning how to use data and evidence for policy making. And also, as Teddy already said, that we need to develop a common language for expressing the demand for policymakers to be able to express their demand for data and evidence for their work. B, for researchers to be able to deliver actionable data and evidence. And then again, for policymakers to be able to use that for decision making. So we need these groups to be together. Moving on to the next slide. So what is the overarching problem that we're trying to address by delivering these trainings and bringing these groups together is to sort of bridge the gap between the disconnect between researchers, practitioners, and policymakers. And why does this disconnect exist? Well, there's a mismatch between what the different groups need and what they have. Right? So researchers, they need to be continuously and actively engaged in the policy design and implementation process. Whereas policymakers, for example, they seek out data and evidence only at certain moments of decision making, where the researchers might not be able to deliver effectively. And then the policymakers have data that researchers don't have access to. So there needs to be a lot more collaboration and bridging of the gap. So in a nutshell, that's what we're trying to address through these trainings. Next slide. So what are the strengths and weaknesses of this approach that we've used in Bangladesh thanks to EPoD? Well, of course, it encourages and promotes this baseline language, having a common set of conceptual frameworks, case studies, discussions on research methodology, and of course the participant discussions using all these methods for learners to be able to effectively learn. This is a great opportunity for researchers, policymakers, and practitioners to practice working on common problems and learning how to use data and evidence. The challenges, if I'm allowed to list them, the first is the narrative used for delivering the content when we're talking about data and evidence is not necessarily relatable to all groups at the same level, right? If we take case studies that are quite recent and people can relate to that, policymakers were involved in the stories that we're using, the narratives that we're using, that might be maybe politically sensitive. The diagnosis and critical analysis approach that we take, it can very easily veer towards a discussion on the content, on what happened actually, instead of, our purpose is to use that as a demonstration of how to use data and evidence, right? So that it's a tricky thing to manage. And then when we talk about methods, as Charlotte said, there's a big section on impact evaluation. When we focus on methods, for researchers, it's too simple because that's, baby talk to them. And for policymakers, that might be too complex. And I put complex in italics because it's not because policymakers don't have the capacity or ability to understand research methods, but for them, it's not really relevant to really understand the technicalities of research methods. What they need is how I'm going to use this and interpret it, right? And then when we do group work, as a result, if you put a researcher and a policymaker together in a group exercise, when it comes to working on methods, the policymaker will rely on the researcher to do that part and just sort of sit back. So then when we do an assessment, in our final assessment, it was very clear. There was a clear divide. The researchers did much better in our final assessment compared to the policymakers because they already came in with a stronger technical knowledge base. Next slide, please. So where do we go wrong usually? Because these trainings are delivered by mostly academics as well. I'm an academic myself, and as a researcher, when we designed the content, there's a temptation to jump to methods very quickly, right? So this might not be the best approach. This is not relatable for policymakers. It's not interesting to a lot of them. And then researchers often seem outdated to policymakers because policymakers deal with very fast moving and fast changing issues. They have challenges and issues that they're dealing with right now, important policy issues. While researchers, their analysis, the nature of research is such that we're always a little bit behind because, once we understand the question we're trying to answer it, issues have changed already. So for policymakers, that's also a challenge to be sitting in the same room and discussing these things. So as a result, when we have pre-designed case studies and assignments, they're not live enough for policymakers. To be interesting to them, they have to be live issues. So as a result, what happens in these sessions is that, it's very difficult to have practical discussions. And the discussions end up being sort of what we call ought to discussions, right? So we talk about what should have happened at that point, what we could have done, and then policymakers are thinking, oh, but the context was such that we couldn't have done it anyway. So then we have this hypothetical ought to discussion, which is not really practical all the time. So that's the usual case that happens, and content and discussions therefore have to be carefully designed to avoid this sort of mismatch of demand and supply for the policymakers and the researchers in the same room. Next slide. So little learnings that we take forward when we design more courses similar to this one is that knowledge delivery has to sort of step back and step down a little to be able to really translate and communicate what we're trying to deliver here to policymakers. Another important point is that who delivers is key. So for policymakers and researchers, for both kinds of learners, it is very important for them to have confidence in the person who is delivering the content because both groups are experts in their fields. So we need someone who, first of all, is trusted, and also has the experience and kind of that philosophical overview to be able to
Just waiting to see if she comes back. Oh. Manaz, you there? Hi, Manaz, are you back?
Sorry, I just got
No problem.
I'm glad I was just done.
So we just finished hearing you about the importance of trust in the person who's delivering the content.
Right. And the last point I talked about already, that the content has to be live, which means that the content has to be constantly updated and contextualized. This is not the kind of course material that you prepare once and then you deliver for months and years without updating. So that was it from my side.
That's wonderful, Manaz. Thank you so much. If there are additional questions in the chat, please do share them. We got one related to a prior section, which we'll get to later, but I wanted to focus on Manaz's section. So Manaz, you talk a lot about what's so difficult about making these interactions work, these collaborations work across one another, but obviously it's incredibly important for all the reasons that you mentioned. So in your mind, and I think the slide that you're currently showing kind of gives us a roadmap, what characterizes a successful collaboration between a researcher and a policymaker? What sort of characteristics does it have, and what should we be striving toward?
Okay, so first, obviously, there has to be confidence on both sides. On both sides, we usually think about policymakers having confidence in researchers, but it also applies for the other way around. To be able to communicate effectively, there has to be mutual trust and respect. The second thing is that researchers have to be actively engaged throughout the policy design and implementation phases, which is often something that policymakers miss. When they come looking for data and evidence, it's usually not readily available or usable because it's not the right time. And researchers are not able to deliver timely, relevant analysis. And the other characteristic is communication and translatability. So when researchers understand clearly the demand of policymakers, and policymakers are able to take deliverables from researchers and use that quickly without having to further analyze or translate what researchers are giving to them, that's when you have a successful collaboration.
That's wonderful. Thanks so much, Manaz. Your point about the sort of timeline of academics versus policymakers, I think it resonates a lot with me. Just as an academic myself, just like you, relevant to us means it happened a year ago and we got the results in only a year. And to policymakers, they're thinking about what happens 2 months from now. And we need to sort of figure out how to make that balance. So we got a wonderful question in the chat from Alessandro about the relation between science and policy is also a question of ethics. So you say trust is very important. How can we sort of get trust to be built between sort of the producers of evidence and the policymakers? What characterizes a trusting relationship, and how can we get there more effectively?
I think the issue, what I was trying to say about knowledge delivery stepping down a bit is important because the more we are able to deliver meaningful and relevant data and evidence to policymakers, the trust is going to build automatically. And that means for researchers not to be always driven by academic interest, but also to serve immediate needs of policymakers. So the incentives of researchers are often not aligned that way. So once we do that, once we have that relationship and collaboration space functioning smoothly, the trust, I think, will come automatically.
That's very interesting. And I think Albert, building on that, asked about a difference in epistemologies, by which he means, researchers rather value particular sources of data, types of data, qualitative evidence, things like that, whereas policymakers want sort of performance indicators, right? So even what we choose to measure and how we value it might differ. Have you encountered those kinds of tensions in terms of what measures are valued and how they're interpreted?
Yes, I wouldn't call this a tension. I think it's the responsibility of researchers to also demonstrate what can be done with the data that's available with the government. For the policymakers, it's not always, it's not always clear all the things that can be done, all the analysis that can be done, which is why they stick to very simplistic, maybe performance indicator sort of data. And the other usual trap that researchers fall into is always, focusing on the negatives, which makes policymakers defensive. So researchers have to take on that, friendship relationship where they have to demonstrate that we're doing this to help you and help you in your work, make your performance indicators look better. And this can be done with this. So we need to demonstrate that for this to work.
Understood. Thank you so much. This was incredibly helpful, Manaz, and I really appreciate it. It actually speaks to a comment that Mohammed made in the chat, which is that there is this tension between, as you mentioned, the need to sort of act fast as policymakers and the need to be technically correct as researchers. It's quite clear that there's a challenge there, but the need to make maybe academics like us a little bit more willing to focus on imperfect but useful data rather than the most effective and technically correct data. And on the policy side, encouraging a culture of a little bit more reflection and systematic thinking that we've been trying to do. Finding out sort of like the middle ground between those two things seems incredibly important, and we're very grateful for your feedback on that. I want to make sure that we have time for our next two. So Anshu and Shreya will be talking a bit about data quality and use in the field. So one of the big pushbacks we've gotten is concerns about data quality from policymakers. So I'm quite interested to hear what they both have to say. So Shreya and Anshu, thank you very much.
Thank you, Teddy. It's great to speak here, and thanks for setting the stage for us. I think Teddy, Charlotte, and Manaz have very nicely set the context of what happens when we are in the classroom. And I think Shreya and I, learning a little bit from our work in India, want to step out of the classroom for a bit and talk about what actually is our thematic area, which is the quality issue or the trust in data. And in our work, we often come across policymakers who have, maybe been motivated through a training of ours or elsewhere and are very motivated to do evidence-based policymaking, but see a lot of data, but don't trust it at all. So the problem isn't a lack of data, the problem is lack of quality data. And a lot of you have also mentioned that as a challenge in the poll that we took at the beginning of the session. So I think what we want to focus on in our section is building strong data systems and thinking about capacity building on data systems in addition to and in parallel to building skills and knowledges of policymakers. So what do we mean by strong data systems? A strong data system is essentially a data system that collects quality data and that stores it and presents it in a way that facilitates decision making. We'll go over these three steps throughout our presentation: collection, storage, and presentation, and how quality of data gets compromised at all of these three stages and what can be done at these three stages. But before that, I just want to re-emphasize why do we care about this and why do we want a strong data system? I think what we've seen in our work and what a lot of research also tells us is that strong data systems can help policymakers identify problems much faster and react to them in a more proactive manner than in a reactive manner. And I think the current circumstances around the world sets a beautiful context, rather sad, but for this example, at least good on how governments needing to be proactive is very essential in many cases, in many policy responses. So the point that I want to make here and want to emphasize before we start off our section is that the entire sort of theory of change of evidence-based policy making or capacity building for evidence-based policy making rests on the very idea that the data that is available to be used by motivated and skilled policymakers is actually usable and is actually of a quality that will inform decisions in the right manner. And often we've seen that this isn't the case, especially with administrative data that gets collected throughout governments, and often policymakers lose this trust in data. So why does the trust get lost? And I think we want to get into a bit of that in the next few slides. So starting with the collection stage, the first very important thing to think about is the incentives of the data collectors themselves. This is something that we delve into a lot in one of our modules, which Charlotte introduced initially, the using data systems, where we use economic frameworks like the principal agent theory to think about principals and agents within data systems, where agents would be collectors of data and principals are the users of that data or decision makers. And that's where the quality gets compromised when you're not able to align the incentives of the agent with that of the user of the data, which is the principal. And what further worsens that problem is that, at least in a lot of government departments in India, what we see is a lot of the assessments are based on targets that are provided to data collectors who are then assessed based on the very data that they are collecting themselves. That is a direct conflict of interest for them. And as it's stated by the Goodhart's law, it's a measure and it's target at the same time, and therefore it's not a good measure to be able to feed in good data into the system. So even if you're not familiar with economic frameworks, I think the basic takeaway from thinking about quality issues at the collection stage is to think of the incentives of the data collectors and how you can align them best with the users such that the incentives move away from misreporting to true reporting, even if it's bad outcomes, but it's true reporting. There are some solutions that we've collated over time and thought of, and in the interest of time, I won't go into each of those. They're on your slide, but I think the main takeaway here that I want to emphasize is there's a lot that can be done, but there's unfortunately not a lot of evidence-backed interventions available for this. And different departments that we speak to are willing to try different approaches, but there isn't a lot of evidence available out there to be able to replicate. And if there are members in the audience who've experimented or tried any approaches to address this principal agent incentive issue, I think we'd be very excited to hear from you. Moving on from the incentive issue, I think genuine data entry errors are also another problem where data quality and trust in data gets compromised. And here technology can help a lot. The basic characteristics of data systems where data entry issues become big are data systems that rely on overburdened data collectors and which do manual data entry often on paper-based formats, as is the case with many government departments still in India. In this case, though, we've seen some success in a particular area where the government department in India responsible for nutritional outcomes for mothers and children up to the age of 6 and early childhood education, called ICDS, have slowly now moved from complex paper-based formats for data collection to a smartphone-based application, which has subsumed all of the 11 different formats that were earlier used to fill in data into one pretty nifty application. Of course, the benefits of this is that there is now a single point of data entry for all kinds of information for the data collector. And it links all of the data for a single beneficiary in one place. So you get a 360-degree view of what the beneficiary is accessing services and what their status in terms of nutrition is. It also reduces data collection time and also the possibility of errors at the data entry point by reducing the need to repetitively enter data across 11 different formats as used to happen. But of course, this comes with challenges because there's resistance from frontline workers where there's a capacity issue and they are not very comfortable using smartphones and they would rather stick to their old formats and do paper-based collection, or they live in areas where there are technological errors or just network issues and they are not able to switch comfortably. But I think overall, we are seeing the benefits of switching from a paper-based format to a technological based entry collection method, which has helped in improving data quality overall. Another aspect of data collection that determines the quality of data that gets fed into the system is the instruments that are used to collect that data. And also the capacity of the data collectors who are using this data to take the measurements and enter the data. As you can see on your slide, we've done some observational studies in India where we've studied how basic anthropometric measures like height and weight were being taken. And this is an area which requires very nuanced data collection and is common to areas which use anthropometry like health, nutrition. The instruments are, as you may see and notice, not being used correctly. And this is in turn leading to data being entered into the system, which probably doesn't reflect the true status of nutrition outcomes and thus is in misinforming decisions or actions that probably were taken based on this data. So providing the right instruments and building capacities at the frontline level where the data is being collected and entered into the system is key to ensure that there's quality data being entered and the trust in data of policymakers way up the hierarchy that received this data feel comfortable using it. Because as you can imagine, if I were to show, which unfortunately we had to, these pictures to a policymaker, he or she would walk away with the notion that the quality of data that I'm receiving is absolutely not reliable, and I hence would not want to use that in any of my decision makings. And we are working hopefully to move away from such takeaways to rather use our trainings and our interventions to motivate them to actually do capacity building at this level to fix this issue rather than avoid all of the data altogether. I would like to end my section by referring to a recent paper by Dasgupta and Kapoor called The Political Economy of Bureaucratic Overload, which actually has been a fascinating read for a lot of us who have seen the phenomenon of bureaucratic overload in our work very often, but now have evidence-backed reference to it through this paper. And what this paper essentially says and finds is that because of the overburden of government officials, a lot of the managerial tasks get crowded out because there's a lot of firefighting amongst the various priorities of the government officials. What we have heard anecdotally in our work is data-related tasks do squarely fall into this category of managerial tasks as referred by the authors, where they are seen as coming at the opportunity cost of other work, possibly providing services. And this problem is especially acute in data systems where the frontline worker, frontline service provider is also the frontline data collector. So he or she is competing with the priorities of actually providing services versus filling in data for those services across, possibly 7 or 11 different formats. And so what happens is the care with which the data is entered is compromised, and thus begins the vicious cycle of, garbage in, garbage out, and that erodes the trust of data of policymakers across the level, because they know that this is probably done not with the highest care and not with all of the attention that it needed. I'd like to now pass it on to Shreya, who will actually, in fact, allude to this phenomenon a lot through her slides, but also talk of 2 other stages, storage and usage of the data system and how data quality gets compromised at those stages. On to you, Shreya.
Thanks, Anshu. So I want to continue with this example of where we might see this kind of bureaucratic overload and understand really how it affects data quality in use, particularly in contexts where, like Anshu mentioned, the frontline data collector is also the service provider. So even though we've seen that it's costly for government organizations to design and implement data systems, we find, interestingly enough, that organizations have several channels of reporting running in parallel. And what's even more interesting is that sometimes these data systems seem to collect information across a common set of data points. So what happens when there are multiple sources that exist for the same data, the collection exercise becomes inefficient and that much more confusing. To illustrate with an example from the health sector in India, you might find several reporting systems. We've illustrated 3 here, where the data collector is actually providing information on vaccines at birth across different formats. And what this means for her is that at the frontline field level, she has to administer the vaccine, but also report this information across multiple formats. At the level of the users, the senior administrators, it can become quite difficult to reconcile discrepancies that come across from these different data sets. And this can further just undermine their trust in the data that they're getting. Moving on, I think, in terms of addressing quality issues, I think we also want to think about requiring additional information to actually get to the source of quality issue. But what happens if the data by itself in the design of reporting is transformed into an output that doesn't necessarily preserve the scope to dive deeper? So for instance, what you see on your slide on the left could be example of data and how it's collected in the field at the individual level. But through the process of reporting, it gets transformed and is reported only as aggregates. What this means for the end user is that they cannot use this data to undertake any kind of analysis, look at service delivery gaps by location or gender and just generally disaggregate this. They cannot also get to the root of any quality issues because the underlying unit level information has just been lost. And then couple this with the multiple reporting systems that exist, users who want to then further cross-verify information from different sources might just find that the units of aggregation are not the same across these different data systems. So in some ways, I think coming back to Anshu's point about building strong data systems, addressing inefficiencies and building scope to use data better also require thinking about the end users of this data at the design stage. And one way of doing this could be allowing data systems to interact with each other by building scope for linkages. This could be through common unique identifiers, for instance, and then can reduce the inefficiencies associated with data collection. I think a more important point is also that linkages allow users to construct a more complete picture and really try and understand the story their data is trying to tell them. Health officials in India often understand the importance of maternal health outcomes when, understanding the determinants of infant mortality, for instance. But if they want to get into their data and find that these data sets live alone, then policies targeting childhood health and nutrition cannot really make use of all the available data sets because they don't really speak to each other. But I do want to emphasize here that, it might seem like the solution is design a good data system, which in some ways it might be. But like Mehnaz was mentioning, it's always good to think about what could have been done, whereas in fact, it's really difficult to replace an infrastructure that's been put into place and redesign a data system that already exists. So I think it's also important to think about what can be done by just looking at the data sets that exist to improve quality and to inform future decision-making processes. And like Anshu mentioned, a lot of the times officials don't complain about lack of data, they complain about lack of quality. These are also officials at the senior level who, like Mehnaz said, are dealing with fast changing and ever changing policies, and they don't have time to look at multiple reports. But changing how this information is made available to them and how it's packaged can really help them make more efficient use of their time and help data be made more actionable. And sometimes this can mean just investing in the right skills at the right level to transform, really long Excel sheets and tables that are reported to senior officers into simple graphs and figures that help them, extract key takeaways quite quickly. So for instance, if you want to get into the determinants of neonatal mortality in a particular administrative level, it might be simpler to do this through a bar graph instead of looking at a table with just many aggregates. Visualizing data can also help you get to the underlying data quality issues by looking for trends, which is what researchers do a lot with their data sets. So for instance, if health officials seem to notice that there are spikes around the global cutoff for low birth weight, it could point to an underlying quality problem, like an incentive problem, where the data collector is not reporting poor health outcomes because they fear penalty and punitive action, or it could point to an infrastructure gap where they don't have the right weighing scales to accurately report birth weight. I want to end here by just emphasizing that data, when it's not used, also doesn't go back to the data collector. And often officials highlight this focus to us when they talk to us about their experiences in the field, that collectors don't understand how their data should be used or why it's relevant. They kind of isolate the collection activity from the service and implementation. But using available data to construct these feedback loops can also help organizations understand the capacity building requirements at different levels of reporting. And while it's true that poor quality data cannot be always used for high-level policy decision-making, letting it live alone might not be the right way. Using this data to actually understand quality-related issues can help organizations diagnose some of these problems that seem to be prevalent, at least in India from our experience. So yeah, I'm happy to stop here, but we can take questions.
That was really fabulous, Anshu and Shreya. Thank you so much both. Again, folks, if you have specific questions that you'd like to answer, please put them into the chat on Attendify. I was hoping, Anshu and Shreya, that you could each speak to one sort of part of this puzzle. So Anshu, I was hoping you could speak to what steps organizations could take to improve the quality of data that they collect, the quality of the data that they actually have. And then Shreya, I was hoping you could speak to what steps organizations can take to ensure that data is actually then used by policymakers. So now we're getting at the big picture organizational concern. So I'd like to talk about it both from the supply of data and then demand for data. So Anshu, maybe you first. What can organizations do to improve data quality that they have access to?
Right, thanks, Teddy. I think that's a very valid question that we struggle with every day when we interact with policymakers. And I think it's when Mehnaz was talking, I was actually thinking about having a room where policymakers and researchers are together. And there's actually a lot that we in our research work do that can help policymakers as well, or get government departments maybe just work their way through the data that they do have and assess the quality and try to improve it. So these could be simple checks like audits of the data, or at least just the notion that there will be audits that could address maybe the incentive issue, where the frontline worker is aware that everything that I collect and report is actually going to be verified by a third party. Once the data is collected, I think just even if you don't trust it enough to use it for decision making, I think what Shreya was trying to show in her slides was just using it to visualize and see where do you see things like bunching, where there's like data being entered near the cutoffs, or there is just trends or patterns in the data that show quality issues. Just visualizing it enough to see where the quality is getting compromised, and finding these fail points is where the departments can begin till they start seeing problem areas and addressing them. Also, just simply building a data culture or a culture of trust within the department. I think our bureaucracy, or at least the Indian bureaucracy, has a profound lack of trust between the different layers of this bureaucracy, and it's something that's been studied by political scientists, and something that's coming to mind right now is something that Yamini Iyer, who is a scholar of Indian bureaucracy, once said is, I think this is something that we inherited from, being in our colonial bureaucracy. The Britishers had this profound mistrust on the Indian officials to actually report or work in the interest of the colonial government. And so our system actually is very mistrusting of various officials at different level, and we sometimes shoot the messenger when they actually report true data. And I think changing that culture towards maybe not shooting the messenger and being more supportive of reporting of true data, I think these are small steps that government departments can start taking. A lot of it policy research or just research does already, and can be adopted into government departments as well.
It's very helpful, Anshu. I think understanding the scope and nature of the problem makes a lot of sense to me for an important first step for organizations to take. So Shreya, this actually dovetails with the question from the chat. The question in the chat is, sometimes policymakers do not follow the rules of using data. What steps can we take to encourage policymakers to actually use it? So to my previous question, how can organizations actually make sure that there's an uptake of data and that it's used effectively?
Thanks, Teddy. Yeah, I think that's a great question. And also in the poll, I noticed that a lot of people have said participants would face organizational barriers to implementing new skills when they return after a training. And I think that ties in very well with what we've also heard from a lot of participants, who've done trainings like the BCure training and have gone back and tell us that we are tasked with running several policy administrations and service delivery. And even if we learn to ask the right questions out of, say, descriptive data, we don't have the right team to help us, right? And I think that's where the avenue for building capacity at different levels to understand what do organizations really need to help these motivated officials at the top make use of data and evidence, and how do we embed these capacities more sustainably? I think a lot of the work that policy and research organizations at present are doing in India, involves being tied up to a government department and placing someone from their organization to conduct data analysis. But I think building scope to do more needs assessment at different levels and identifying training needs of the different tiers of government departments can be the first starting step to understanding these training needs and capacity gaps, and really helping these officials, the data users and data champions, as Charlotte calls them, to better use data and evidence. And I think another point related to just building feedback loops, I think this is also where policy research can be quite promising in understanding what data is already available and how do you present it back to the data collector or to the midline functionary, and what role does technology play, for instance, in communicating across different tiers of government organization. So I think there's also tremendous scope for more work and more research engagements in these fields.
That's wonderful. Thank you so much, Shreya. I think your point actually speaks to something that I think is important with respect to our approach at BCure, and those of you who are at this event who are yourselves trainers, I think probably have a good sense of this. Being, as a trainer, I think responsive to the needs of the folks who you're training or the organizations who you're training seems quite important. So when we first did our BCure needs assessment, the big picture questions were, being comfortable with data, making sure that there's sort of a culture of data use and things like that. Issues of data quality came up so often that our most recent module, our most recent sort of training offering has been in this sort of data systems question that you were both talking about. So trying to figure out how we organizationally can lead to and foster better data systems feels quite important. So thank you both so much. We now have about 15 minutes or so for broader questions and conclusions. There were a couple from the chat that I wanted to speak to that relate to training online, teaching online. So I think here's a chat question that I think was quite well said, and maybe I'll speak to it just a little bit before that. So the question was, as remote work becomes the new normal during the pandemic and no longer the exception, remote training is not far behind. How to know about successful remote training and make the transition as seamless as possible? So I was very happy to see this question because it's an enormous topic of interest of mine. So my work at the Kennedy School focuses largely on pedagogy, especially online learning, and trying to understand the extent to which online learning can be effective. So I think many of us, when COVID hit, were put in this place where it felt like we suddenly had to make these massive pivots and didn't quite know where to start. When it comes to training, if you take on the kinds of frameworks of pedagogy and learning, as opposed to, say, just more rote questions of how to train effectively, there's an enormous literature, an enormous amount of information on what makes online learning effective, simply because there are these massive organizations like Harvard University and Yale around the world who are focusing on online learning and have a really vast literature on how to do that well. The short answer, I think, is doing a lot of the things that we have been doing in our trainings already, and maybe folks on the call can speak to this, creating a situation where when people are together live, like on Zoom in this case, and not physically in a classroom, making sure that you are making the most use of the fact that everyone is together at that moment, at that same time, and not sort of offloading things like lecture slides or talking directly at participants instead of engaging them in conversation, that's really an incredible opportunity, I think, to make the most of the conversations that you have together. So understanding the blended learning approach that we use in BCure, a huge part of it was to do a lot of the training before we even got together, look at the data from the trainings that we did, and then when we actually got together, making sure it was customized to their needs, but also as engaging as possible. That, I think, is a principle that also translates very well to online. I'm very curious to others on the call if you have had other experiences with respect to online teaching or any insights from the different trainings that you've each spoken about. Any thoughts?
I can jump in here, Teddy, just because when I saw that question in the chat, well, first, I'm glad that you spoke to it first, because if you gave it to me, I was going to say Teddy is, for those on the call who don't know, absolutely the expert at HKS right now. He's, I think, understated how much he's really been leading the way in bringing all of the Kennedy School's residential programs online too. So grateful to you for sharing that wisdom, Teddy. But two things that I thought of when I saw that question in the chat, and there are a whole host of things, but two in particular, I think were around tech and engagement. So these are two sort of challenge areas that I think of when I think of doing online trainings. So I'll tackle tech first. There are obviously going to be, as I think we've all experienced this year, snafus with technology, people's internet cutting out. And the reality of it is often in training contexts where you're trying to bring in people from a global cohort or in low bandwidth settings, you're more likely to face that. And so I think it's fair for trainers and instructors to feel frustrated by the idea that you can realistically, hold a bunch of high quality, high interaction Zoom calls. And so one thing that we've thought about doing to mitigate against that is blending more of the asynchronous and synchronous content. So what you were just talking about, making the most of the in-class time remains relevant, but I think it's also acknowledging that there's more stuff that can really be done before the class. Things also like just recording the in-class section to make sure that you're making it available to learners who experienced difficulty logging on, I think go a really long way. Benefits of that too, I think, translate to how we think about the BCure model and the second piece that I wanted to talk about, which is engagement. And the asynchronous work really does allow for, I think, more engagement because the instructor is able to get more of a constant pulse on what people are thinking. You have all these different data points from your learners that you're able to check on comprehension and learning and incorporate that into live teaching. So I think that that is useful. And for any trainers in the room who are thinking that, they don't have the ability to create like a MOOC style program, I think, and I've learned some of these from you, other strategies for creating that blended format can be as simple as introducing like a Google survey before you enter the classroom and making sure that you're getting as much information as possible to, as you say, make the most of that live time.
Wonderful, thank you. Other thoughts?
I can just quickly share our experience. We've been offering some short courses online for government offices after COVID. We found that the challenge was more on the trainer side because I think that learners are quite proficient now. They're competent in participating in online sessions, and the tools, technology is there, but not all trainers know how to use them effectively. So that's something I think will improve over time as people get a better hang of it.
Yes, I think that's a really, really good point. And so if I can speak a little bit from my experience, both training in these contexts and also training, as an instructor, a couple things come to mind. First of all, this speaks to both what Manaz and Charlotte was saying. I think when we imagine online learning, we imagine MOOCs, right? Very high quality videos in which people are narrating and interviewing each other, super technologically complex, in-depth Zooming with lots of polls and things along those lines. I think that notion of that being the best thing is actually not really borne out in terms of my experience, simply because learners are kind of getting inundated with very high quality videos that they're seeing on YouTube and things like that. And people are getting overwhelmed by the technology available to them. So my advice to y'all is to really focus on how much you can get from as little technology as possible. So having a simple survey, such as a Google form, having a reading instead of a elaborate video along those lines. These are the kinds of things that I think can actually get you quite far, 70, 80% of the way there without having to make these super high production videos along these lines. So think about what is kind of the core of what you're trying to communicate or change as a result of your training, and then see how you can adapt the learning structure to that. The second thing that I'll point out, and this speaks especially to what Manaz is saying, it's, I think, quite important to have backup plans and then backups to your backups and then backups to the backups of your backups for what's actually happening in Zoom. So today, if anyone on this call dropped out, one of us was ready to sort of take on what they were going to say in their slides so that they could kind of fill their role as needed. We had lots of backups in different other documents and things like that. Technology is going to fail. And in person, the worst that can happen is that you end up in a room together and then you can at least talk to one another. In Zoom, if technology fails, you can't even communicate with one another. So understanding how to work this into low bandwidth environments and understanding what kinds of backups you could create to sort of account for potential issues strikes me as quite important. Okay, so we have another question. Few countries are able to produce the country-level data required, but the proliferation of data are creating new opportunities for monitoring and decision-making as well. How have you faced data interoperability issues, thank you, in a standardized way? So this is something we talk quite a bit about in our data systems module. I wonder if anyone on the call wants to talk about interoperability between data systems and ways in which that can be accomplished.
Sure, I can start, and I think Shreya can add, because we were talking about linking data systems earlier. I think that's a huge problem that we see in our work with admin data, where all of the various departments are collecting data on the same beneficiary, but are working in silos, and there's very little data being linked across the various departments. And like Teddy said, that's something that we speak about in our data systems module. But I think there's a long way to go till that convergence actually happens in a practical manner. And there's different issues. I think it's, departments aggregate data at different levels. So they lose the individual level data, like Shreya was mentioning. And so it becomes harder to link data across departments when you have data at different levels, even though it's speaking to the same population or the subpopulation that it's targeting. Also, formats vary. There's misunderstanding on indicators, especially in like health and nutrition, things like that. And so I think there's a long way to go till we actually see a good linkage of data, and it's something that we speak very much about when we are doing trainings, and a lot of our data champions who are motivated officers from our trainings are looking into it pretty seriously and are hoping to work on. But so far, I think there are very many interoperability issues that do plague the administrative data space in India. Yeah, Shreya, please feel free to add something I've missed.
Yeah, thanks, Anshu. Actually, I was thinking about this also in the context of how these data champions or users of data in policy making use evidence outside of admin data sets. So I think one thing that's been interesting to note is that officials often are aware of national surveys and standardized surveys that are done that have certain protocols, and they really are interested in looking at information and reports from these surveys or different areas of research, and then trying to understand whether their administrative data is giving a different story. And I think there again, there's this immense capacity building gap where they may not have the time to really understand and get to how research was done or how a survey was conducted, but helping them understand what questions you need to ask out of different data sets can really help them understand this interoperability issues that they might face, even if their current data sets are, like Anshu said, living in different silos. So I think this is again an area where even in our capacity building trainings, we try to get to the alternative sources of evidence that exist to really excite the audience and help them think outside of just these admin data sets and help them understand how else they could be looking at their data and improving its quality.
Wonderful. Thank you all so much. So we are just about out of time. I see a question from Albert that I think is quite important, or rather maybe a statement of his experience. I think transitioning to online is certainly going to be challenging. And like you, it will be great to have NGOs safely together in the same space so we can learn to do this more effectively. So I just want to close with a thought in the chat from Fauzana Ismail. They say, for me, it's a good experience working and collaborating with many researchers. Of course, there are differences between policymakers and researchers in certain ways, but from what I've observed and experienced, I believe we can work it out together and appreciating the quality of the data. So I think that's a great note to end on. I wanted to very, very sincerely thank our participants, Charlotte, Minaz, Anshu, Shreya, Amelia and Laura. Thank you all so much for your insights and your help in making this happen. Thank you all who have participated and joined us. Charlotte has been sharing our emails on this slide. Please do get in touch if you're interested in learning more or collaborating with us on some of this work. And I hope you have a wonderful rest of the conference. Thank you all so much.
Thanks, everyone.
Thank you. Thanks, Teddy.
You.